I'm Dr. Schwartz. I'm the naturopathic doctor at Benton Integrative Medicine. And I am one of the doctors who oversees our functional medicine programs. Um, so I do want to start by saying how much I appreciate you all being here. Again, it is a Monday night. You're taking time out of your night on the first day of the week, especially after a long weekend too. Um, but it tells me that you're very serious about your health, and that's what I admire. So thank you all for being here. Um, I'm really hoping to give you all some insight into our program, kind of how I practice and what we look to achieve with any program, with any condition that walks in the office. So that's what tonight is all about. I'm just going to walk you through our clinic's functional medicine program, go over what we feel like are some of the main problems with the state of healthcare right now, um, and talk about some common patient presentations that we see and that we work with that are truthfully not very well managed in healthcare right now, or at least how the system is set up, and really just how functional medicine is different, and it is the approach that a lot of people are seeking. Um, that's what I want to do because some of you may be familiar with functional medicine, you may not be. So I want to make sure that I appeal to both audiences and but also give insight into how we work. So our functional medicine program is designed and intended to do something that the traditional model often misses. And it doesn't offer, to be honest. It's to not just get you healthier, but it's to lead you to hopefully lasting health. And that is what a functional medicine program will do for you. Whatever you're walking through the door with, um, I look to get that better. There's no doubt about it. But to me, it's about something that is sustainable for your health. If you figure out where it's coming from and we address what led to the way that you're feeling right now, and we can modify that, well, then the logic there is it is not going to come back. And that is what is most important to me. Um, you don't have to know everything, and I don't. It's called practice for a reason. We learn as we go, but you just need the right guide who isn't chasing the symptom. You have a headache, don't take the ibuprofen. If you're constipated, the Miralax isn't telling you why you were constipated to begin with. I want to uncover the why, and I'm going to say why a lot tonight. The why is important. And I want to correct that underlying imbalance, that root cause that some of us might be familiar with. And I want to keep people well for as long as we can. That's my goal here. So, again, I touched on this here just a minute ago, but the difference between conventional medicine and functional medicine, I think that that's important to differentiate right now. So let's compare them. The conventional model, more Western medicine, right? Visits to the doctor, visits to the hospital, perhaps. What do they look like? The focus in conventional medicine is by naming the disease. And once you have that name, then you can match it with a drug. And, it's very disease oriented in that way. We have X condition, here's Y treatment for that condition. It's algorithmic, it's very reactive. And what it can miss is the the years maybe leading up to disease, the trends that's getting us to that point. At that point, we react to it. We're not acting very preventatively. So on the other hand, move myself over here, you've got functional medicine. And again, we're asking why here. This is very health oriented. Health care, it's kind of a misnomer, right? I mean, we want you, if we medicate or if we have to go into surgery, of course, the idea is to get you out alive and well. But this is very health oriented in that, you know, it's why do you have migraines? Why do you have IBS? Why can't we sleep at night? Why am I gaining weight? What is driving that anxiety? It's very patient centered for your bio individuality and your experience. We have time to go over that and time to analyze that. not just what is happening, but what has led to that point. That's the why. Um, and in doing so, we're able to look at the entire system. We respect each system of the body. It all makes a difference to me. It's head to toe. It's present all the way in the past, as long as we need to know that's pertinent. Um, I mean, it doesn't matter what walks in. We could be asking about your gut health, your hormonal health, your immune function, your mitochondrial health, your energy, your sleep. It all makes a difference to me. I want to patch every one of those gaps up because, again, the logic there is if you are creating the conditions for health, health is going to follow. So that's all the systems in our body. We are also respecting the relationship between mind and body, and spirit and body, and mind and spirit, and how important that is to healing, how important it is to get into a healing mindset. No matter what, I want to work with someone who believes that they can heal. And sometimes I have to be the cheerleader, and I have to remind them that your body is made to heal. It's made to live. That's what it's doing day in and day out. And I've had so many appointments where someone will tell me that, this is the first time that someone has connected the dots for me. And that means everything to me because that's what functional medicine is. It's meant to empower you with the knowledge and the understanding. The deeper dive you take, the more data that you get. And with that data, you understand yourself so much better, how you tick. And when you have that information, you can take action. And I'm all about the action. So just getting right into it, elephant in the room, cost. Why do we work outside of the insurance model? Well, insurance complicates care that is given. And with that, it limits what a provider is able to give. So insurance is great in ways. It is designed for the acute care that we seek, emergencies, surgeries, those short-term visits that I was talking about, those very quick illnesses that pop up. It's not preventative. It doesn't optimize your health. And it definitely doesn't get to the root cause of why it's there. You can't do that in as quick as the medicine model today runs. So it's very rewarding to quick visits and symptom management. But our program is very different than that. And that's why we have to go out of pocket and outside of insurance. We have to be able to cover that time and that effort that we put in together. I want to work very hands on with you. It isn't, have a 15-minute appointment. Here's what you have to do. I'll talk to you in 6 months. That rarely works, if ever. uh, because it's a journey. I mean, healing can be uncomfortable. It can be long. If depending on how old you are in my attendees, if this is something that's been going on for 5, 10, 20 years. I'm not going to reverse that in a 15-minute visit. I have to get to know you. I really have to know you inside and out. And you have to know you inside and out. And that's what I try to figure out. So to work in each category of that and make it true holistic health, we need the time and we need the resources to do that. So that's the value in what you pay for with any functional medicine practitioner that you're working with. It isn't quick. So in our current healthcare model, are we wrong or are we just lacking information? Um, I think that the healthcare system is pretty strangled right now. You have good doctors who want to practice good medicine, but it needs to be very fast paced and quick turnaround. And you got to get in and out to see the amount of people that you're looking to see in order for insurance to cover it. But on my side of the desk, despite America spending more per person on healthcare than any country in the world, do our outcomes really show for it? I would say no. I would say that Americans are getting sicker. The chronic disease rates are sky high: obesity, diabetes, depression, record highs. Something isn't working. So I don't think the problem is a lack of care. We have plenty of care, and obviously we put good money into our care. I think it's just the wrong kind of care. We've been given incomplete information about what health truly means, what it looks like, and how to sustain it. And who else to hear that from better than your own physician, right? We're supposed to be the beacon of health. So we certainly practice what we preach here, and we walk the walk. I know I'm doing a lot of talking tonight, but I walk the walk. See, I got if anyone saw, I got my green juice here that I'm drinking tonight. So, in the current system, like I mentioned earlier, you're defined by that diagnosis, and you are matched to a medication. And the pharmaceutical industry, I mean, it profits billions off of this. I might be speaking some of your languages here. It's a great business model, but that's the truth of the medical industrial complex. And there's nothing wrong with medication. I'm not here to trash it. We use it when we need to. Um, it is sometimes life-saving medicine. I give it credit. Um, but what I'll often see with medications, I'll see patients on multiple prescriptions for years, right? And no one is asking, um, how are you feeling? How are you feeling without those medications? And what was the imbalance in the first place that led to you requiring those medications? That's the questions I'm asking every day. Again, I'm all about the why. So if you come to me and you're on medications, wonderful, I can work with you. If you want to get off of them, fantastic. And if you want to avoid them, great, right? Because remember, if you were on that drug, you were on it usually for life, because when they get you to a certain point, they say, hey, it's working, stay the course. And that also makes you uh, uh, a source for money, for life. So if we're looking to get out of that web, I think functional medicine it's what has helped me. It's what I have used to help many other people avoid that cycle. So most chronic health problems today are rooted in some type of stress. That I believe, albeit physical, chemical, or emotional. So physical stress can be traumas, poor posture, pain syndromes. I mean, even just how we sleep, we can consider that physical. Chemical stresses. Now, those could be toxins. They could be inflammatory. They could be pathogens, maybe nutrient deficiencies, even. This is, that's where I love to live. I mean, I'm very good at the chemistry and the emotional side of it. Now that I never dismiss, it's arguably more important than the chemical component of it. That's everything from your stress to your anxiety, even unresolved traumas that we're dealing with, grief we're going through, whatever is weighing us down bioenergetically between the ears. Sometimes um, it we have to break that cycle, break that chain, and get back into the belief that our body can heal. So you might experience common symptoms, bowel difficulties, constipation, diarrhea, right? Maybe energy is low. We're very fatigued. Our libido is very low. Or, of course, we're gaining weight, right? Many of my patients will say, um, I've I'm doing everything the same. My diet looks the same. I'm exercising. I'm sleeping all right. Why am I gaining weight? Or I wake up tired and I go to sleep tired, or even go to sleep wired and they're just backwards. That's not normal. That's a sign of imbalance. And my goal is always, why in the heck is that happening? And there's always an answer. The body knows, and it's telling you every day. We just have to be good listeners. So I make that priority number one for me, is to listen to you, meet you where you are, and then, of course, educate and give my best recommendations. More common symptoms too. Let's think about mood, right? Anxieties, depressions, insomnia, right? Are we able to fall asleep correctly? Do we stay asleep? Are our thoughts racing? What's waking us up? What time of the night is waking us up? I mean, when your body is out of sync and out of rhythm, the brain, the hormones, the chemistry, it follows. It's all connected. Um, I think a good example would be fixing someone's digestive complaints with fixing their sleep. That's something that we see often. Gut brain axis. If this is suppressed, deficient, a little chaotic even, then everything down here is going to follow suit. And it's a two-way street, right? Or is our gut what is keeping us wired and awake or tired and fatigued? So different people will express imbalances very differently. Some folks are estrogen dominant, others are adrenal, others are thyroid dominant, liver and insulin resistant. I think this is a very cool slide. It's very basic, obviously, but you can see that if you're a keen provider, if weight loss is a goal and we don't know why we're holding on to this extra weight, if you can observe how we're holding that weight, that actually tells us a lot. And common symptom profiles that come alongside that weight gain. For example, if you're estrogen dominant, perhaps we're holding more weight in our hips and in our legs, where our skin is probably much drier. Maybe our hair is thinning. Adrenal body types, on the other hand, usually they're puffier around the abdomen, and that's where we're holding our weight. And we have a lot of adipose tissue there, perhaps in our face as well. Our face kind of puffs up and swells. um, Thyroid body type, weight all over, right? Everything is gaining weight. I just can't lose it. I feel like my metabolism's stuck. Perhaps I'm constipated. There's likely some hair thinning with that too. Your body temperature might be very cold. I mean, these are the signs. These are the signs that we have to correlate with whatever labs you have, even if they look good, right? The labs can sometimes be deceiving. But knowing your pattern helps us tailor all of the nutrition and supplementation and movement that you need and lifestyle and maybe even medication. But it's not just happening to you, right? Your DNA just doesn't wake up one morning and say, I'm going to hold, henceforth, I'm holding 25 extra pounds of fat, right in my midsection. That just doesn't happen. Something catches up with you, sure. The aging process, natural order, it's going to happen. Um, but what has led to that point? Have we been giving our body the input for it to store that weight? What is going on chemically? That's what's most important to me. So hormones being one of those chemical messengers, right? And this is a very abbreviated slide, but just to give some insight into things that I'm looking for and what matters to me. In one way, you have fat burning hormones, and then you have fat storage hormones. The fat burning ones are the ones that keep us young and keep us vital. Growth hormone, insulin-like growth factor, thyroid, testosterone, and you have out of balance, generally fat storing hormones. If our insulin is through the roof, or our estrogen or our cortisol is through the roof, then we're sending the body an email every day that says, "Hey, don't let go of that fat. Hold on to that. In fact, maybe even make more." Right. So, just an idea of labs that I look at and how I use them clinically. Let's also use thyroid hormones as an example, because this is one that I see often, and I might be speaking to some of you with this one. I know that not all of these examples are going to match what all of the attendees are coming to me for, but I want to pick several examples that I do have a lot of overlap with, and generally we do find some dysfunction in. But for thyroid, most doctors, and you all have probably had these labs done, but most doctors are looking at TSH and T4, maybe if T4 if you're lucky, right? But thyroid physiology is far more complex. Um, and and this is a very basic outline. I mean, it's incredibly basic, but just to fit it on the slide and show what's important here. So TSH comes from the brain. So TSH is not a great read on exactly how the thyroid is functioning. TSH tells the thyroid to make T4, and then that T4 has to be converted to T3, as you can maybe follow along here with the arrows. That T3 is what's most important. That's the most active hormone the most active thyroid hormone that we have. So again, why are we only looking at TSH? Why are we only looking at T4? It's not even the complete story start to finish. So what I do is I expand that panel and I find a bottleneck in exactly where that underactive or overactive thyroid is occurring. So T4, for example, as you can follow with me here, it's converted to T3 in liver, in the periphery, in the gut. Um, so if I see a patient with maybe underactive thyroid, or we're seeing some low hormone levels, um, it isn't just so much you've got low thyroid hormone. Let's give you a pill to give you more. No, no, no. The body knows what it wants to do. It's just not getting there for some reason. So let's say the problem is in the gut, right? Let's say we have SIBO and we have a lot of dysbiosis, inflammation, maybe leaky gut. If we fix the gut, now we're giving T4 an optimal space in the body to then create the T3. And you might not even require extra T3 once we get to that point. So you see how it can get a little bit complicated. And I'm not even going to get into it, but then that T3 has to become free T3. And free T3 is the end of the road. That's what we want. So we have to make sure that it's getting there. And it gets very complicated, but that's why I'm here. I'm going to break that down for you and tell you exactly what we need to do. And you know what? Let's make it even more complex, right? Adrenal glands. If you all are familiar with the adrenal glands, the little gland that sits on top of the kidneys, it makes cortisol, like I was talking about earlier. Thyroid and adrenals, very intimately connected. They are best friends most of the time, but they can also be the worst of enemies. So when cortisol is high from, let's say, chronic stress, we've been stressed out for a long time. I've got work, I've got family, I've got this responsibility, this responsibility. That's going to block TSH. And if TSH can't make it to the thyroid, then we're not going to be making T4. But that cortisol can also block T4 to convert into T3. So to me, wouldn't it make sense if we've got underactive thyroid, we don't exactly know why. Maybe we're otherwise living a healthy lifestyle. Let's look at your cortisol levels. Because if those are a little funky, then we've found where we need to work to restore that thyroid connection. Otherwise, this is going to leave you tired and foggy, even if your lab numbers look fine. If we get those thyroid lab numbers looking great and cortisol was the issue and we never addressed cortisol, again, you're a patient for life. You're going to be on that thyroid hormone replacement medication forever. Uh, but I really want to unpack that. I want to unpack the whole thing. I want to look at everything and make sure that we aren't missing something that could be driving the problems. Let's take it a step further, right? And now we've got the immune system that can get in the way. Autoimmunities, if any of you all have heard of autoimmunities, thyroid or Hashimoto's, the autoimmune condition for an underactive thyroid. Graves is an autoimmune condition for an overactive thyroid. These aren't even thyroid problems. They're immune problems. They're immune dysfunction. And the immune system then begins to attack the thyroid. And that could often be due to, again, I mean, we're looking at gut permeability, chronic infection, nutrient deficiencies, whatever it is. But if we can identify those triggers and calm them and restore the immune function, well, then your thyroid is finally going to be given a break because the immune system's not going to be attacking it all the time. But while that immune system's attacking the thyroid, you'll see those numbers go down or go up. And if we're practicing quick medicine and we just say, this looks like a thyroid problem, run the labs. Oh, they're high. Oh, they're low. We got to medicate with this. Then you're on that medication. And it's more than likely that at some point you'll hit that wall and you're not going to feel any better. You might not feel worse, but you might not feel any better. Labs look good though, right? No, no, no. We have to treat the immune system. And this is incredibly common with thyroid especially. But look at some of these at the bottom of the screen that show up too. Our brain can be affected by the same thing. It's essentially how I'm looking at conditions like an Alzheimer's or dementia, gastrointestinal too, IBD, Crohn's, ulcerative colitis, endometriosis for our reproductive organs. The immune system can create quite a problem if it's left unchecked for a long period of time. So you got to leave it to a functional practitioner who can look at that and make sure that we're addressing where the source of the problem is coming from, not the reaction to what some labs look like. Now, insulin resistance is another major root cause. Um, again, very abbreviated slide here, but this could be contributing to your fatigue, driving your brain fog and cravings and inflammation, aches and pains. I mean, balancing blood sugar is one of the most powerful steps that you can take for long-term wellness. But that amount of blood sugar that we have in our bloodstream at one time makes us feel a certain way. So small changes in that, you can already begin to feel improvement and see the progress. But having being very insulin sensitive is what protects your metabolic strength and metabolic flexibility long term, as well as hormone balance. So it's always a part of a panel that I run is I make sure not just to look at fasting blood sugar, um, not even to just look at HbA1c, but also check the insulin levels and the ghrelin and the leptin and make sure that I'm cross-referencing that with the other hormones in the body because it's sometimes hard to trace, but if you've seen the labs a lot, you begin to see that it's a pattern, and the body knows what it's doing. You just have to break that pattern. So, additionally, we're talking about too, see it all the time. I think we all know the cholesterol dialogue is changing. For decades, it's been painted as this villain, and I would say that emerging science is finally starting to show that it's a bit more complicated than just high cholesterol. You're going to have a heart attack. No, 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 no. It's cholesterol is a vital nutrient, is a hormone. Our brain uses it as food, and it's critical to repair cells in the body. We can't just tank it because we think it's plaquing our arteries. It's not about total cholesterol anymore. We want to look at particle size and ApoB and lipoprotein A and how much oxidized LDL there is, and is it inflammatory? That's how you get the full story of, is this cholesterol just moving throughout the pipes and doing its thing and actually healing our bodies? Or are the pipes cracked? Are the pipes rusty and we're beginning to kind of calcify and make atherosclerosis? That's the conversation that you need to have with your physician, especially if you're on a statin or being, pushed to be on a statin. It happens all the time. That cholesterol threshold is pretty low. A lot of people come in with their cholesterol elevated and they're worried about what to do next. Um, but the more data we get, the better that conversation becomes. And I can be very realistic about what needs to be done. And we also need to understand what's called relative risk in medical studies. So Lipitor, a common statin, a drug like this might claim to reduce heart attack risk by 36%. But in this study, if the original risk was 3 in 1,000 and that drops to 2 in 1,000, the actual benefit there is pretty tiny. So how this medical research is able to make the marketing sound a little bit more dramatic than it is, that's very real. And that's not fear mongering. We just have to take a dive into the literature and talk about what the literature is showing. It makes you a more informed patient, and you can, again, the power is in knowing here. We want you to feel empowered with the information, and A, B, C, whatever options you need, what aligns with you, we're here for you. But even to go on this a little bit further, JAMA, right, a pretty distinguished medical journal here, back in 1995 reported that there's no evidence linking high cholesterol levels in women with heart disease. Interesting. And then the American Journal of Cardiology, even. No difference in arterial calcium buildup and risk factors. So again, it's why context and individualized care so much matters. It's not, it's no longer a one size fits all approach. You all are your own person and your own chemical machine. And we have to understand that better so that you can take action to understand you better. Why not? One more here. New England Journal of Medicine, another very distinguished one. 33,000 people in the study, so a pretty big population that it looked at, showed that the medications lowering blood pressure, lowering blood sugar, and cholesterol, they didn't actually end up reducing the heart disease deaths. Uh, pretty significant finding there, and this was just in 2010. Um, so again, lab numbers, they're just not the whole story. And function ends up mattering far more than the markers in a patient. And I like talking about the function, hence the name functional medicine. It's very important to me. So statins, while we're on the subject here, let's use statins as an example of a medication that is very commonly prescribed, and a lot of people are on them. What do these medications potentially do? Well, they can deplete pretty important nutrients. For statins, one pretty important one's CoQ10. We see that all the time. If you're on a statin, you better be on a CoQ10. Um, if we have less cholesterol because the statin is reducing that cholesterol, we'll have a reduction in the amount of sex hormones we produce. We won't be able to produce as much estrogen. For a man, we won't be able to produce as much testosterone. Um, and again, the emerging science about statin medication and brain health, right? Are we lowering this cholesterol too much, and is it leading to cognitive decline? There's some pretty compelling evidence coming out that shows that may very well be the case. Um, Again, not a scare tactic. There's a time and place for medication. This can be life-saving medicine if we get bad cholesterol out of your bloodstream. But we have to understand the full picture and then balance the benefits with the long-term consequences. So while I mention it, let's go to cognitive decline. Um, uh, I mean, look at some of these numbers. This is becoming an epidemic, and yet it's rarely addressed as so, and it's rarely addressed proactively. Um, but brain health is influenced by those hormones, your nutrition, your inflammation levels, your blood sugar, right? In my field, we're beginning to call um, Alzheimer's and dementia type 3 diabetes. That's how important it is. So it's no longer about genetics. You might be a little bit more genetically vulnerable, uh, but you can take action for this. There are ways to avoid and in some cases potentially reverse this. So like I talked about, low estrogen, right? Let's draw the parallel between our hormone health and dementia. Now we're taking out cholesterol. Now we're not going to be producing a lot, much more hormone. Now our estrogen levels are low. Maybe we're postmenopausal, even our estrogen levels are naturally low right now. So we're two steps back. Thyroid hormone as well, right? How important it is to have optimal and not just normal. I'll get to that soon, but optimal levels of thyroid hormone in the bloodstream for brain health. Sugar levels, I just talked about that. Type 3 diabetes, remember that. I mean, these are all modifiable risk factors. So when you look at addressing this and really fixing a cracked foundation in health, it isn't just about how you feel today or yesterday or tomorrow. Uh, I have you 5, 10, 20 years down the line because that's functional medicine. It is the art of preventative medicine. If we take the time and we put the effort in right now to build a better foundation and create the conditions for health, then things like this far less likely to happen and you're lowering your risk. And we'll use that too. We'll use estradiol. I do have that mentioned there. I should mention it. A natural bioidentical estrogen replacement to reverse any damage, right, that's being caused from all of these issues and having the deficiency in whatever hormone or nutrient levels or chaotic sugar levels in the blood. Because there's always a reason behind cognitive decline. And there's not really one pill that can truly fix this. But our job is to identify the missing pieces in this. And that's that deep functional dive that you all are probably craving to help restore the balance. So we've seen patients regain memory and regain mood, and they're not lonely anymore, and depression is fixed, and we're motivated once again because we ended up getting back to that root cause. It's very possible, and there's no such thing as a hopeless patient. So if you've had a doctor who has told you, this is what it is for the rest of your life, get a second opinion, get my opinion, and let's see what we can do. Because you give the body what it needs. It wants to live, it is fighting to live every day through every symptom you have. It is your body's fight. And we just got to listen to it. So if you've been told that your lab results are normal, but you still do not feel well, put that in quotes. How many times I've heard that and seen it when a patient's brought me their labs. It's one of the most common stories I hear. Um, Traditional lab ranges are designed not well, they are designed to detect disease. They are not designed to optimize health, right? Those ranges are pretty wide, and functional medicine will narrow those ranges to suit your demographic and focus on here's the optimal range. Because if we space it out like this, and a lot of this science is old anyway, and they used it for patient populations that might not even match who you are. So if it's this wide and it's covering this big of a base, then by the time you're outside of that range, well, the disease has already taken over. Right now we have more work to do. It's going to be a harder journey. But if we're falling outside of that optimal range, then in theory, we're in the perfect spot. You're walking that line right now between progression of disease or reversing that and getting back into true health. So I have TSH on here. It's a great example, talking about thyroid again. I mean, you can see 0.3, they let that thing get down pretty low before they think that there's a problem. Me, I like to see it around 2, 2.5. That's really good for me, and it's a goal that we can strive for. But as soon as it's outside of that range, well, then you get the label and then you get the medication. But what about if we catch the trend that's leading up to that range? That's where I want to live. I want you to be the best version of yourself 10, 20 years from now. So a couple examples here. The testosterone on top. This one is for my men out there because that is a male's range. And I do have some men attendees in here. Um, but this is a great example. What is optimal testosterone? That conversation is changing now too. You can see that they'll let that get down to about 200 in some conventional labs. But you lose a lot of preventative health benefits if we're letting testosterone get down to 200. And I assure you, you do not feel great. You do not feel like a man. You lose your vitality. You lose your vigor. And it does have consequences in other systems of our health if we don't have enough testosterone. So we look to optimizing that. I look at free testosterone levels, sex hormone binding, globulin. I make sure that everything is intact and we know where this is coming from. And then we make a smart decision on how we want to move forward. And cortisol, again, talked about that earlier. Another one, it's worth checking, and it's worth doing a diurnal cortisol curve. So we can see, who am I in the morning? Who am I at noon, afternoon? Who am I in the evening? Because I'm sure you all can agree we're different people when we wake up and when we go to work, and then when we come back and have dinner and we're with our family and going to sleep. We feel very different at this time of day and this time of day. Is our circadian health healthy? Is the biology of cortisol too low when it should be at its highest? Is it too high when it should be at its lowest? This makes a dramatic difference on how you feel and how the systems in your body runs. So, functional ranges will help us identify these trends before issues develop. But without the proper testing, it's essentially driving with your eyes closed. We have to have the data, and once we have the data, we can personalize the plan. Nutrition, supplements, lifestyle, mindset, any extracurriculars we have in the office to correct the dysfunction at its source. That's what's most important. So that's where we come in. And I know a lot of that was sciencey. It might have not aligned with you. I just want to show you that we do our due diligence, and that's why functional medicine was created. It's supply and demand. People demanded this medicine because they felt sick. in the other healthcare system. Um, so we are here to guide you through that and make this as easy as possible because it gets complicated quick. Our bodies are very, very detailed, intricate machines. And I want you to have structure and accountability, and I want to give all the compassion that I can give for your situation. I never want you left wondering what to do next, and that's what any good provider would give. So here's something I put in here that I think it speaks volumes. Um, it, it- the World Health Organization at a point in time has acknowledged that 90% of all diseases prevalent today are not treatable with the current medical procedures. I think that's pretty powerful. Do you? I mean, this is a call to action to look deeper. And that's exactly what we all should be doing. That's what I want to do with you. So now what? You kind of know how I work and how I think and how we wanna treat as a clinic. What do we do now? So the goal is we get the testing done and we have a much better understanding of where is this coming from. And then from there, we're focused on what is causing it, not necessarily the symptoms. I'm really not concerned with the labels. Sometimes they're helpful and they give me direction, but I'm not putting a label on you. I want to see the chemistry improve, and I want to see that correspond qualitatively with how you feel. But if we're correcting the dysfunction, that's what's going to happen. We address the body as a whole. So it isn't just try this supplement, right? There's no supplement that's an analog to a medication. It just doesn't work that way. But if we want to leverage that supplementation, or medication, even we've got to make sure that the body's firing on all cylinders. Otherwise, you are going to have a need for higher doses of medications, more medications. You'll be switching from medication to medication. When the body is running efficiently, then the need for that becomes much, much less. So we take that kind of a systematic approach. And for me, the most important one is that last bullet point, the mentoring and the monitoring. I want to make sure that you leave better than when you came. You are always learning something new about your body and you are applying what you learn. And that's my favorite part of the message medicine. That's my passion. It's why I do this. So again, why do most people feel unwell? You've got a couple of puzzle pieces here, and my goal is to put all of those together because when one of these pillars collapses, one of them, the whole structure is wobbly, and that's the truth to it. That one right there says nervous system, right? Do not forget the mind. So when we get them back together, that's true holistic health, and I hope that's what you all are seeking with me, because that is how you get out of the system. And that is how you finally start feeling well and empowering your body to move forward. And I have it here too. It's important, but our program is exactly that system that leads you away from possibly failing with X, Y, or Z approach. It is structured, it is supported, it is strategic. It is for you. I handwrite them. I handwrite every piece of information that I give you. Um, Unless there's like an article or resource that I want to give you, it is catered to you. I do not have a one size fits all approach. So take a moment to reflect here. I know I'm probably going over a little bit. Um, how are your current health challenges affecting your life, your relationships, your work, your ability to be physically active, enjoy life, and go on that vacation and not have to worry about this or that? And really, how motivated are you to change it? Because that commitment's important to me. I don't. I We shouldn't work together if you're not ready to heal. You have to want it. You have to know your why. And I'm gonna ask you your why. You can guarantee that if you work with me. I want to know why you want to get better. Are you in that mindset? Are you in a good time and place in your life where you say, enough is enough. Enough is enough. I'm ready to get healthy. I want to be me again. Because health is about making bad habits into good ones. Uh, Again, our culture, our medical system, we are reactive. We wait for the disease and then we respond. But functional medicine is very proactive, and we strengthen that foundation so illness never takes hold. And I've got a silly little picture here, but you get the message if you've looked at it by now. Let's walk the dog. Let's not try to cut the corner and drive the dog. So, how to get started with me, everything I just talked about, how we're going to go through it. So, it's a consultation with me first, and that's very important to me. I have to know as much as I can about you and what you're bringing me, how I can best serve you. So, this consultation is actually two parts. It's two visits, all for the total of 695. Um, in that first visit, it's a complete, thorough history. You guys fill out a lot of forms for me. We do a lot of talking. I need to know what direction we need to go. Is there a treatment we have to get right into? What are the labs that we have to look at? What is screaming at me that this is the most important? And then from there, that second appointment is going over any of that lab work and then creating the plan. Um, and that's usually when we are connecting the dots and we have some aha moments that's like, this is it, we found it. This is what we have to correct. So that's the consultation. And for being on this call tonight with me, you actually get a discount off of that. It is not 695 for you. It is something 500 ish. So we're going to give you a discount for being here because this is dedication to listen to me ramble on for, you know, coming up on nearly 45 minutes here. So thank you for that. And I want to show you that I care about what you care about. So silly slide. I know. Who is it for? Everyone. All of these attendees who are in here right now. I mean, you can have a chronic condition or hormone imbalances, gut health, whatever it is. Maybe you just want a comprehensive approach. Perhaps you are in great health and you just want to know that you're living optimally. It doesn't matter. You can be one day old. You can be 101 years old. This is for you. You can always get better. So transparency about the investment. After that consultation, if it is a good fit and we feel like there is enough work that we can do together, and I'll shoot you straight, then what we will do is we will get you into the program with me. It's just how we have to operate. And the program is 6 months long in duration. Um, let's break it down because I know the price is probably jumping at you. Like, what in the world? Divide that number by 6 and then divide that number by 30, right? Because this is everyday hands-on medicine that you're getting with a trained professional. With that, is all the personalization. It is all of the monitoring. Everything's tailored to you. We are in constant communication. How are you doing with this? Good? Put on the gas. Or not so good, we're hitting a plateau, haven't found change yet, we've got to modify that right away. That's a good program because I'm not a genie. No doctor out there is. If they give you a program and promise to change your health around, turn 180 and walk the other way because it just doesn't work that way. You each are your own individual sets of physical, chemical, and emotional chemistries. Um, so I need that time with you. I need that ability to interact and communicate with you to get you better. Everything is customized. All the supplements that you get for the first 2 months, that's a part of this. That's included. I want to get you on the right foot and make sure that we're making the right choices. You'll have access to all of our wellness services in the clinic: the sauna, acupuncture, biocharger, and we also, I mean, this is a big one. We also allow for our functional medicine programs to be covered under direct primary care. So let's say there's need for medication or medication oversight. We can do that for you. If we need hormone replacement therapy, we can get that to you. We are this year and finally in the last few months getting our peptide services underway. If you need that and that can benefit you and that can leverage you, we've got that covered with our nurse who's administering that. So it's way more than just here's the program. See you later. Hope you get better. I'll catch up with you in a couple months. We are very proactive to make sure that from day one to the final day of the program, you are better, you understand your health, and eventually we can pass that baton to you and we can equip you with the tools and knowledge and the clarity to maintain your health moving forward independently. I mean, we're here for you as long as you need us. You can always just be a primary care patient. But you won't need me forever. You might not need functional medicine forever. We can do our checkups, but you will hopefully graduate this program healthier and with the confidence that you can sustain these results that we got together. So again, our ultimate mission here is we are looking to help you reach that optimal level. I'm not worried about getting rid of your headaches or losing 20 pounds. I want you to be the best you that is healthiest. Any doctor's office you walk into, they will say, wow, you are doing great. That's what I want for you. Um, and this investment, although the sticker shock might be there, again, break that down with me and really understand what you pay for that. The value is in there. If you invest in that now, you are saving on probably countless medical costs long term, missed experiences for being ill, lost energy where you can't do the stuff that you love that makes life worth living. Um, and to do that, we try to offer the payment, make the payments as accessible as possible. Discounts for pay in full, of course, interest free for, I think it's more than 3 month installments now. I should update that. And we do have advanced care, which breaks down that payment to monthly payments over a long term, interest free. So it's just like a bill, basically, a smaller one every month. I want to work with you. I really do. And I hate when finances get in the way. But if this is something that you can do and you can say this is worth the 6 months for hopefully the next 10, 20, 30 years of my life, that's how I see it. I want to leave you with all of that and open up the floor to the Q&A. Just type in any questions that you have for me. I want to make sure I get those answered. I'll be here for an extra 5 or 10 minutes just to make sure that if anyone has anything to say, comments, concerns, I can speak to it. You can go ahead and toss those in there for me, if you will. Because if you've been looking for answers, if you've felt unheard or kind of stuck in that cycle, then you know I designed this program to be the bridge for that from where you are now and where you look to be, and I'm talking with you the whole time to make sure that we get there together. So with hormone replacement, we use bioidentical hormones, and there are different ways to administer that. There are creams, you can use troches, suppositories. There are oral routes that you can take. Um, we match it to you. It matters. You know, if we're looking at hormones, we'll look pretty extensively into how well you metabolize estrogen, for example, or what your androgen metabolism is, and we'll make sure that it's the right route of administration for you. But we have options doing it that way. Uh, let's see. Do you have experience with men who have Hashimoto's? Yes, absolutely. How many months can you do on the payment plan? I just spent about 7,500 of my life savings with another functional medicine and still have issues. Believe it to be Hashimoto's. Wow. Okay. I'm very sorry about that. I'd like to say that it likely wasn't all for nothing. I hate that you're not feeling any better. Um, if we work together, I'd like to know who the practitioner was and what they did with you, so that I don't do the same thing and we make sure that we're looking elsewhere. Because if you feel no better, then something was done incorrectly. Um, but the question about men with Hashimoto's, yes, it is not as common. It's a little bit more rare, but yes, it does come in our door. It does come in our office. I have worked with plenty of them. And overall, the 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 treatments and what you look to do for the body are the same, right? It's immune dysfunction, like we talked about earlier. We've got to look to why is the immune system overacting and then charging the thyroid. Um, but there's a little bit of difference in between female and male biology, mostly how the thyroid is connected to the hormones, the sex hormones. All right. Oh, here's another one here. Um, Dr. Brownstein. Okay. He says you need much more than the recommended dose, that each cell in your body needs iodine. There's an iodine loading test that determines how much is being utilized by the body. The OS theory. Yeah. Yeah, absolutely. Definitely familiar with the iodine loading test. Um, and I think iodine is incredibly important, and we do not get enough of it. Our salts that we use, our table salts, are iodine free, and um, not everyone's eating really the foods. A lot of it's seafoods that are important to bolster the amount of iodine that we have. So the deficiency, or I wouldn't even call it deficiency, I'll say the suboptimal amounts of iodine. Yeah, it's pretty ubiquitous. But I do play with it a little differently with my autoimmune patients, especially my Hashimoto's patients. We'd have to check and make sure that we do not have an autoimmune thyroid condition before we play with any iodine. Question here: is the initial 695 worked into the overall price if you sign up, or is it separate? It's worked in. So hopefully that, I mean, we really do want to work with you all. And we want to make this as achievable as it can be. Um, but we give access to our providers very liberally. And that's what gets the price up, is really just how much care you receive over the course of that 6 months. Uh, that's what makes the price what it is, and that's why I say divide it by six, then divide that by 30, and that's really what you end up paying for. Absolutely. Thank you so much for being here. My pleasure. I really hope I get to work with you. And again, with the consultations too, remember you get a discount for being here tonight. We'll send that out through the follow up email. Um, and the consultation, there's no commitment with the consultation. If we do the consultation, we at least get to meet one another, and I get to know you. We go over all of the lab work that we need, and we talk about what needs to happen. If it feels like a good fit and it aligns for you, then let's do it. But there's no commitment to that. In the very least, what you get is more information about your body. And I'm going to make sure that you are empowered with that information, whether or not we're working together. After the initial program, does your facility operate as a typical doctor's office? Like if you have some issues that come up, like a bee sting or something unrelated to hormones? Yes. So uh, within the functional medicine program, you get access to that care if you need it. So you have that during the 6 month period as well. After that, hopefully you're in a much better spot. But if you just want someone who is functional and holistic minded to manage your primary care needs, then all we do is transition you to that. It's uh, we work outside of insurance mostly, um, and the fees are usually just monthly fees. I think it's maybe 199 a month. But you are under our umbrella of care, and with that 199 a month, you get all the access that you need. So you need 4 appointments a month, you can get those 4 appointments. And if it's hormones, like you mentioned too, let me talk to that. Whether you choose primary or maybe it's really just hormone, your health is in a great spot, and we just want to maintain hormones and monitor them, make sure, hey, I'm feeling well and my hormones are at healthy levels. Um, then we have providers that do that too. So uh, at the end of the functional medicine program, we kind of make sure that you get to where you need to go, especially if you want to stay with us. Then we try to be a hub for your health as best we can. That's what Dr. Benton has done with the practice. She has many different types of providers who can provide different care. How many years have you worked in this capacity? Oh, do I look young? I'll take that as a compliment. I'm probably much older than you think I am. Um, but I've been doing the functional work for, oh, goodness gracious. Now, this is my 6th year doing the functional work that I've been doing. Prior to that, I was doing a lot of naturopathic care. I'm a naturopathic physician. That's my background. Um, but I'm also a doctor of chiropractic as well. Um, Toss in there, I have a license in North Carolina to practice clinical acupuncture. So I've had my years in different fields, but at the end of it all, I practiced all of it as holistically as I could. I found that my best blend was if I'm functional with the patient and I have the options to use things like chiropractic and acupuncture. That's the stuff I'll use to leverage health. But for functional medicine, it's become my baby, and it's how I've seen my own life change. But uh, my patients' lives change. It's not a bad thing. I'll be 40 this year, and still people still think I'm in my 20s. That's awesome. That's awesome. That's a great sign of health. Are you kidding me? Are you kidding me? You're probably doing much better than you think you are. But if there's stuff in your health too, because we were talking about the Hashimoto's earlier, that is something we want to control now, right? And that's why you did it. You just spent a lot of money to work with another functional medicine doctor. But with our clinic too, and I want you to know, you're working with me. I'm the one really overseeing the functional medicine program, but we're very collaborative. It's in our name, right? We're integrative. We have multiple sets of hands and eyes on cases to make sure that I'm not missing anything, that they're not missing anything when I look at them, and that we make sure that each case is getting the attention to detail that it deserves for the price that you pay. Dear. I do want to thank you all. I don't even know if I said thank you yet, but thank you for being here. And if you are ready to take that step, then we are going to send out an email. You can call in our office. You can go on our website, and get that link to get scheduled for the consultation. Um, if you choose to work with me, I really cannot wait to meet you. It is uh, the highest honor and my favorite thing to do. And I really hope that I get that chance. So with that being said, and no more questions here, I'm going to sign off for the night. If you need hormone therapy after it is regulated, do you continue to monitor it? And is there a monthly fee? Yeah. Yeah. So we do monitor it. I mean, once we get you feeling good, it's much less frequent, but uh, we want to avoid, yeah, possibly overstimulating with any type of hormone. We like to see those levels baseline at the minimal effective dose where you are feeling the best. So that monitoring is very important. And you can go to any doctor's office down the street, and they'll probably give you hormones if you're of age and you have certain symptoms. I mean, we give birth control to very young girls that are sometimes not even contraceptive, but to work on, digestive and PMS and mood changes. Like, you'll get your hormones, but how it's monitored is most important to us. Once we have you qualitatively feeling your best, we want to stay there and make sure that dose is continuing to be appropriate for you. Right. So with that too, again, hope to meet you all at a consultation. Thank you again so much for being here. If there's any other questions that you need, just give our front office a call, and they'll make sure to have everything answered for you. Okay, but I hope tonight was helpful. I'm really glad that you all were able to make it. And I'll hopefully talk to you soon. All right, everybody, be well. Have a great night.